Well, certainly, Darwin, these have been some trying weeks for all Americans with the coronavirus pandemic. It's been a tough time at Advocate Health Advisors, but we've certainly readjusted, and everybody has reworked their work environments and figured out new ways to communicate with agents. So maybe you could just tell me a bit about how it's going for you, how it's going for Advocate Health Advisors overall.
Well, it is a challenging time, but I have a personal and a professional strategy that says whenever you get into a difficult situation to try to make the best of it. It does remind me more of my military days, though, than my corporate America days. But, if you had told me a couple of months ago that I was going to be at home with my family for a couple of weeks, I would have been excited about that. And so, in fact, I am. We're having some fun. We've got some projects done. Also at work, the team's been incredible. They've all been able to move into a work from home environment, still able to talk and communicate with agents. So it's really the best of both worlds in some ways.
Are there any tips that you could offer for advocates agents in this new environment we're working in?
Yeah, sure. Well, other than being savvy with digital media and the electronic enrollment and the blocking and tackling, but really, I just want to encourage everybody to call your clients. There's a ton of things to talk about, telemedicine, mail order pharmacy, but more importantly is reaching out to talk to every single client you have and just let them know you're there. Hear what you hear, handle what needs to be handled, but mostly let them know you're there for them at a personal level. That's super important right now.
So true. And I'm sure so many of them appreciate just having that support and hearing from us. And then how about for the older adults in our communities, our family members, our neighbors? What kind of tips do you have for them? What can we do for them?
Our clients really need to be protecting themselves right now. The clients in the home are a very vulnerable population, and this is a super serious thing. So not only do they need to follow the guidance from the CDC about sheltering and all the things that you hear a pretty good information flow about, they really want to be thinking about other novel things. There's some silver sneaker benefits for activity. Your activity can regulate your mood. We talked a little bit about telemedicine, and that's not just for coronavirus symptoms. Telemedicine can help you with those regularly scheduled appointments and save you from going out of the house. And that's the big deal. It would be terrible to go to the doctor to try to be well or to go to the pharmacy to try to get your medicine and actually cause yourself more harm than good, right? The Hippocratic Oath starts with do no harm. But you got to be an active participant, and clients now more than ever have to be active participants in their own health.
Are there any other tips you would like to share?
Right now, I think it's a double-edged sword. You have to try to do two things at once. You have to try to protect yourself and do the right thing. And you also, you still got to eat, right? Life goes on. And so we have to find that complicated balance between the two. Each person is unique in their own situation, but there is a lot of good advice out there. I think that really everybody is doing all that they can. And with that, I'll thank you for your time.
Thank you so much, Darwin. It was a great conversation, and hopefully we'll continue this here.
Thanks, Karen. I appreciate you.
Okay. Bye. Thanks.